physiology revision, we will shift our attention now to nerve muscle physiology. Physiology of nerve fibers, physiology of muscle fibers. Understanding this nerve muscle physiology is the foundation for understanding neurophysiology later. We'll understand about the nerve fibers. First and foremost question, the cells that are found in the central nervous system, two important group of cells. The first one is obviously the neurons. What are these neurons? They are our functional units. They are actually supported. We all need this person, one supporting friend who is always there for us, who will help us in every possible way. And who is the supporting role? They are obviously our glial cells. Glial cell is going to play the important role of supporting role. They will ask you, which cells are more numerous, neurons or glial cells? Remember, there is one neuron means there are 10 glial cells. This is the ratio, 1:10. So obviously, who is more? The supporting players are more. The ratio is 1:10. Glial cells are 10 times more numerous than a neuron. So functional units, supporting cells, glial cells. First, let's focus on the supporting players, glial cells. Two group of cells, my dear friends. The first group, based on their size, we call them as macroglia. If they are small in size, we call them as microglia. This is the broad classification. Macroglia and microglia. Now first let's look into this macroglia, the big size ones. The classical examples, satellite cells, swan cells, oligodendrocytes, star-shaped astrocytes, ependymal cells, big size ones. The small size one is actually the microglial cells, whose primary function concerned with some immune functions, phagocytosis. Microglial cells performing immune functions. What about macroglia, sir? I will tell you now. Look into this very important table. One is sure shot. This star-shaped macroglia helps in forming blood-brain barrier. Very important. Good support, nourishment for neurons, because astrocytes produce something called as neurotrophins, which are very important for neuronal survival. Other than that, they takes up excess potassium ions. They also takes up neurotransmitter from the synapses. Both these two important aspects we call as synaptic clearing. This is very important for proper neuronal function. So how astrocytes play the supporting role? By forming blood-brain barrier, giving neurotrophins for survival of neurons, takes up excess potassium and neurotransmitter, synaptic clearing for proper neuronal function. Next, oligodendrocytes, swan cells, both for myelination. The difference. Oligodendrocyte myelinate neurons in the central nervous system. Swan cells myelinate nerve fibers in the peripheral nervous system. So oligodendrocytes CNS myelination, swan cells peripheral nervous system myelination. What about microglia? I told you, immune function, phagocytosis, a very important role in immunity. So these immune cells are microglia. Microglia immune functions. So this is about glial cells. Now let's move to our heroes, which is obviously the functional unit neuron. Its structure, very critical, guys. It has got something called as a cell body. Inside the cell body or soma, you see the regulating authority nucleus? Yes. No neuron is isolated. It must receive information. What is that receiving end, sir? MCQ. This receiving end is dendrites. Once you receive the information, it is processed and further conducted. Remember, exclusively for conduction, you need a wire. That wire is axon. Basic, simple question. This conduction can be either fast or slow. What determines that? The conduction velocity is determined by this myelin sheath. If myelin sheath is present, that means always the conduction will be fast. Myelination for fast nerve conduction. Other than that, all this axon end as an axon terminal, which is the one from a nearby neuron that is going to form a synapse. So axon terminal communicates with a nearby neuron by forming a synapse. So these are all the important parts in the structure of a neuron. Most importantly, visible observations. Are you seeing in this axon is the myelin sheath complete? Definitely no. There are some areas where there is no.
Start reading, guys. Start reading.
In this node of Ranvier, what we are clearly seeing, there is no myelin at all. So in place of myelin, what are we filling? A special group of channels that are going to play a role in action potential, sodium channels. So sodium channels are more in the node of Ranvier. We are clearly seeing there is no myelin at all in node of Ranvier. Now guys, few points about this myelin on its structure. First important question they will ask you, what is the lipid that is present in myelin? Very simple to remember. I told you in cellular physiology, cell membrane, there also it is this sphingomyelin.
Neodobus.
What is the protein component? Protein
Start
is
reading.
present in
Bye.
myelin.
Ben.
Its nature, chemical reaction is basic. Its structure, it is a protein. That's all. Myelin, basic protein. The major function, use of myelin is to improve nerve conduction velocity. That means the nerve conduction velocity is fast because of myelin. And diseases, this is where you have to pay critical attention. Autoantibodies, remember guys, if it is directed against our myelin basic protein, our myelin will be destroyed, leading to predominant finding of
multiple sclerosis.
What is the demyelinating disorder? We all know it is multiple sclerosis. Fondly called this as MS. Multiple sclerosis, demyelinating disorder. Autoantibodies against myelin basic protein. By this time you know which cell forms myelin. Obviously oligodendrocytes and swan cells. Oligodendrocytes for myelination in the nervous system, swan cells for myelination in the peripheral nervous system. Other than this myelin, any factor that determine our nerve conduction velocity? Another high yield MCQ. Look carefully, guys. Axon diameter or size is directly related with nerve conduction velocity. If the diameter is big, nerve conduction velocity will be more. What about myelination? Obviously, it is going to increase nerve conduction velocity. What about temperature? Directly related to nerve conduction velocity. That means increase in temperature will definitely increase the nerve conduction velocity. Day-to-day life example, exposure to cold, we have the feeling of numbness because decrease in temperature, cold decreases nerve conduction velocity. Increase in temperature increases nerve conduction velocity. Two important critical physical parameters. One is axonal resistance, second is membrane capacitance. Remember only this point. If we are interested in increase in nerve conduction velocity, then axonal resistance should be more, membrane capacitance should be less. Remember this for solving MCQ purposes. If you want to increase nerve conduction velocity, axonal resistance should be more, membrane capacity should be less to increase nerve conduction velocity. Right, guys. The next important aspect of nerve, an important attribute to it is generation of action potentials. A very high yield area for picture-based MCQ asked many times, particularly in INICT. So revise this topic along with me. In nerve action potential, we have x-axis and y-axis. This x-axis is the time duration. This y-axis is the amplitude. Yes, this is about the amplitude, y-axis. Now look very carefully. Let's start from what is already known to us. A nerve is having a resting membrane potential. How much it is? Minus 70 millivolt. Now look here. To fire action potential, you need a threshold. And that threshold value is minus 55 millivolt. So what is happening in between minus 70 to minus 55? We have the first phase. And what is the name given to this first phase? Local potential. What is local potential? It is the area of the graph that is between minus 70 millivolt to minus 55 millivolt. What is actually happening here? There is slow influx of sodium ions. Because of slow influx of sodium ions, it is moving from minus 70 to minus 55 millivolt. This minus 55 millivolt is considered to be the threshold.
Potassium out.
Whenever this value is reached, action potential quickly fires. What is the second phase? The second phase is depolarization. Extremely important. During depolarization, remember guys, there is rapid influx of our very well known sodium ions. Here it becomes rapid. Why? Because the channel involved here are voltage gated sodium channels. They open. Once they open, there is a rapid, quick, fast influx of sodium leading to this upstroke, that is depolarization. So we have seen the local potential, slow influx of sodium. Depolarization, rapid, fast influx of sodium ions. Following depolarization, the opposite process. What is this third phase? Opposite of depolarization. It is repolarization. The basic cause for this repolarization is potassium ions moving outside. What is the cause? Remember, potassium ions moving outside, we call potassium efflux. Action potential will not stop at the end of repolarization. Look carefully, it goes even more negative. What is this fourth phase? It can reach up to minus 90 millivolt. How much is the RMP? Minus 70. During this important fourth phase, what is the name given to the fourth phase? Hyperpolarization. It can go up to even minus 90 millivolt because the potassium channels responsible for repolarization, they undergo slow closure. Remember, there is slow closure of potassium channels. So potassium still keeps on going out. There is only slow closure. It can be also because of this negatively charged ions, that is chloride ions coming inside, chloride influx. Two important reasons for hyperpolarization. There is a slow closure of potassium channels. Additionally, chloride ions, negative charge, coming inside, chloride ions influx. So during hyperpolarization, it can go up to minus 90 millivolt. Local potential, depolarization, repolarization, hyperpolarization. Next concept in action potential is about refractory periods. What is the meaning of this refractory period, sir? First, I will show you. From where to where? We are clearly seeing from threshold till the initial third of repolarization. We have absolute refractory period. What is this, sir? Absolute refractory period. From where to where? From threshold till initial third of repolarization. Threshold till initial third of repolarization. What is happening? There is inactivation, most important MCQ, of which important channel? Sodium channels. Because of the inactivation of sodium channels, whenever you give any second stimulus here, remember what are we giving? We are giving a second stimulus. There will not be any response. That means it is absolutely refractory. Absolute refractory period from threshold till the initial third of repolarization due to inactivation of sodium channels. Second stimulus you give during this period, there is no response. The next important refractory period, that is our relative refractory period. What is this relative refractory period, sir? from the initial third of repolarization till end of action potential. Till the end of action potential. If you give the second stimulus here, if they ask you, if you give the second stimulus in relative refractory period, if the second stimulus is of maximum possible strength, understand the concept, not normal strength. If it is of maximal strength, then you will be able to get a response. Absolute refractory period, no matter the strength of stimulus, there will not be any response. Relative refractory period, if the second stimulus is of maximum strength, you still get some response. Inactivation of sodium channels is responsible for absolute refractory period. This is what the MCQs asked before on refractory period. Now guys, in nerve physiology, next we are going to understand is the classification of nerve fibers. There are two named classification, my dear friends. The first one is Erlanger-Gassner classification. According to this, there are three important group of nerve fibers. Listen very carefully. We have A group of fibers, we have B group of fibers, we have C group of fibers. Among A, there are subtypes, A alpha, A beta, A gamma,
delta.
A delta. Then we have B, then we have C fibers. Next question. Whether myelin is present or absent is critical. A fibers are myelinated. Yes, very true. B fibers are myelinated. True. The only unmyelinated, that is why it is the most common MCQ. The unmyelinated component is C fibers. A and B are myelinated. C is unmyelinated. Next point. If you look into their size, it decreases from above downwards. That means the largest is A alpha. The smallest, remember, is C fiber. The size decreases from above downwards. Largest is A alpha, smallest is C fiber. Conduction velocity obviously follows the same direction. Decreases from above downwards. That means who is going to be the fastest?
Fastest is A alpha.
Unmyelination. Who is going to be the slowest? C fibers. So the largest, fastest A alpha. Slowest, smallest, unmyelinated C fibers. What function, sir? This A alpha is having both sensory and motor function. Sensory means proprioception, highest conduction velocity. Motor means alpha, alpha motor neuron. True. So A alpha having sensory and motor. A beta is purely sensory. Sensory means touch sensation, pressure sensation. So A beta convey touch and pressure. A gamma is purely motor. What is the meaning of motor? Gamma. Gamma motor neuron. Where it goes to muscle spindles. This A delta is sensory. What it means? Suppose if you have a pinprick, I have a sharp pain immediately.
Fast pain. Okay.
Today night, still my pain persists. That means there are two types of pain. The one comes immediately is first pain. One is persisting throughout the day. Second pain is slow pain. This A delta fibers is for fast pain or the first pain. This C fibers are for the slow pain or second pain. Never forget for your life. A delta, first pain. C fibers, second pain. That's all. B fibers are myelinated. They are preganglionic fibers. C fibers are unmyelinated. They are postganglionic fibers. That's all. Very important. Now listen to me. Proprioception, A alpha. Touch, A beta. Motor to muscle spindles, A gamma. First pain, A delta. Second pain, C fibers.
C fibers.
Preganglionic, B fibers. Postganglionic, C fibers. Unmyelinated, C fibers. Remember, very important. Largest, A alpha. Smallest, C. Biggest, A alpha. Slowest, C. Like this, any type of MCQ they can ask, all based on this important classification, Erlanger-Gassner classification. First type. What about the second type, sir? We call Lloyd-Hunt classification. Only holds true for sensory nerve fibers. Here it is numbers. That is why we call as numerical classification. Erlanger-Gassner alphabets. Lloyd-Hunt numbers. We have 1A, 1B, 2, 3, and 4. This 1A originates from muscle spindles. This 1B originates from Golgi tendon arteries. This 2 is for touch sensation.
Touch.
This 3 is for first pain. This 4 is for second pain. That's
4
all.
seconds.
Now quickly relate this to Erlanger-Gassner. Erlanger-Gassner A
Muscle
alpha.
spindle, Golgi tendons, 2 touch, 3 first pain, 4 second pain. Okay, done.
Here is 1A. Erlanger-Gassner A alpha, 1B. So 1A and 1B corresponds to Erlanger-Gassner A alpha. A beta, touch, 2, touch.
Beta.
A delta, first
is
pain,
3.
3 is first pain. C, second pain, 4. So their similarities you have to remember. So here in Lloyd-Hunt we call as 4. There in Erlanger-Gassner we call as C. That's all. It is purely for sensory fibers. That is why there is no A gamma. There is no A gamma here because A gamma is gamma motor neuron. This classification is only sensory. There is no role for gamma or A gamma. That is why you don't see any relevant or similarity for A gamma here because it is motor. This classification is exclusively for sensory fibers. It is the numerical sensory fiber classification, Lloyd-Hunt classification. So 2 classifications over. Next is this critical structure nerve when it undergoes injury? Where is the injury, sir? Are you able to see? This is the point of injury. Where exactly injury happens at this point. So this part is considered to be the proximal part to injury. This is the distal part. What happens? Any nerve fiber that is injured, first and foremost undergo degeneration. Where? In the distal side. What we call the Wallerian degeneration. Most important. Which is the earliest? Wallerian distal degeneration. Usually begins within 24 hours, within 1 day. Wallerian degeneration. Who degenerates first? The injured axon. What axon is surrounded by? The next one is to undergo degeneration is myelin. And finally, Schwann cells clear the site of injury. That's all. Wallerian happens 24 hours. Within 24 hours after injury, axon degeneration is first, followed by myelin degeneration. Finally, that area, the debris is cleared by Schwann cells. This is Wallerian degeneration distal. What will happen to proximal? It will undergo degeneration at a slightly later time. What is this degeneration? Proximal. Important point. It happens within 36 hours of injury. Wallerian 24 hours. Proximal degeneration within 36 hours. We are clearly seeing nucleus is pushed to the periphery. From center, nucleus is pushed to periphery. One other classical finding in proximal degeneration chromatolysis, which means disintegration or destruction of something called as, very important, Nissl bodies. What are these Nissl bodies? They are the rough endoplasmic reticulum of neurons. In proximal degeneration, there is disintegration of Nissl bodies. We call that finding chromatolysis. So nucleus pushed to periphery and chromatolysis you classically see in the proximal degeneration. So two degenerations over, distal and proximal. The body will try to repair. What is repair the injury? Regeneration. Nerve regeneration. It is considered to be a very, very slow process. That means it will happen only after 90 hours of injury. That means it is the last process, late process, slow process. Regeneration rate only 1 to 3 millimeter per day. Nerve regenerate very slow. 1 to 3 millimeter regeneration per day. How to find out whether regeneration is happening or not? You just do one simple test. Just tap. What are we doing? We are just tapping. If the nerve regeneration is happening, that means the patient will experience electrical shock, like we call this as a tingling sensation. Just tap over the injured nerve. If regeneration is happening, means tingling electrical shock-like sensation. Very good. What we call this sign as? We call this sign as Tinel sign. So all with the T. Tapping induces tingling. Tinel sign positive. That nerve is regenerating. Remember, it is a slow process. Only 1 to 3 millimeter per day. So nerve degeneration, next nerve regeneration. Alright guys, from nerve physiology, let's shift our attention now to muscle physiology. Three muscles: skeletal muscle, cardiac muscle, smooth muscle. First is obviously about the skeletal muscle. For its proper functioning, you need a functional unit. What is that functional unit, sir? That functional unit is called as sarcopia. If it is a functional unit, what you have to see? Two important functional, critically functional proteins. What are those two important ones, sir?
Shit happens. Dudu है ना कि दुदू मैं बस यहाँ ना दुदू. Oh my god. इसी मगर लोग तो जो कि लॉजिकली थिंक करें दो आंसर तो खबर है ना चाहिए Okay. Okay.
Obviously, they should be actin and myosin.
Myosin.
Remember, this green color ones are our actin filaments. This one is our myosin filaments. So sarcomere is the functional unit. In this, we are going to see actin and myosin. Where it will be, how it will be, I will show you now. What is this? A typical sarcomere is none other but the one that is found between two Z lines. That means first important finding, what marks the boundary of a sarcomere? Z lines. What is actually there in the middle? This line is M line. In the end, Z. In the middle, M. Where is actin? Where is myosin? First, let's look into myosin. We have a classical band that is called as A band that comprises of myosin. See, this one is our myosin, A band. The next important band we are seeing here is the I band. What will you see in this I band? Actin. This is actin. See, usually actin and myosin are overlapping. Actin and myosin are overlapping. At one particular point, there is no overlapping. It looks like an alphabet, H. What is this important one, sir? Between this, we are clearly seeing. What is this important band? This is our H band. What is H band, sir? Look very carefully. It is the non-overlapping part of myosin. That contains only myosin. What I told you so far. Boundary lines are Z lines. Middle line is M line. A band containing myosin mainly. I band containing actin mainly. Usually actin and myosin overlap. But particularly in this H band region, there is no overlap of actin and myosin. What you see exclusively in H band is only non-overlapping part of myosin. That's all. There are few attachment proteins. The first one. First mark this. This is my Z line. This is my M line. This is our actin. This is our myosin. True. Now, first and foremost, this actin is attached to Z line with the help of an attachment protein that is called as alpha-actinin. Alpha-actinin. It attaches actin to Z line. So, what is the attachment for myosin now? Myosin is attached to M line. Myosin to M line with the help of this protein that is called myomycin. So, actin attachment protein is alpha-actinin. Myosin attachment protein is myomycin. Next important one, look very carefully. This dotted one extends throughout the length of actin. What we call this guy as he is our nebulin. What this nebulin is going to do, it is going to regulate the length of actin. That is why. How much our actin length is there, that much length of nebulin you will always see. Because this nebulin is going to regulate the length of actin. Actin length regulator, nebulin. Finally, we have a spring. Who is the spring? Look very carefully. It looks like a spring. Being a spring, what important aspect it is going to contribute? Spring means elasticity. See, this is Z line. This is M line. It is extending from Z line to the middle M line. Who is this guy? This guy is our actin. So remember alpha-actinin, remember myomycin, remember nebulin, and finally the elastic spring that is tight. So many protein names we have discussed. Let's make it into useful way for our understanding. See guys, in skeletal muscle, you need contractile proteins. What is contractile proteins? Obviously, actin and myosin. Some proteins you need for support. The first classical example we have seen, titin, supporting protein. Remember desmin, supporting protein. One more D. Who is that? Remember, this is dystrophin. All these are supportive proteins. Regulatory proteins. Most importantly, we have troponin complex and tropomyosin. Another recent MCQ. Regulatory proteins present in muscle, troponin, tropomyosin. If you have a protein for contraction, you also need a protein for relaxation. This relaxation is a calcium pump. What is the calcium pump? Sarcoplasmic reticulum calcium ATPase. It's a type of ATPase, active transport. If this pump is active, that means the muscle is relaxing. What is the relaxation protein? It's a calcium pump that is sarcoplasmic reticulum calcium ATPase. Remember this important muscle proteins. Right guys, for muscle contraction, you need a very well developed neuromuscular junction and a neuromuscular transmission across that. So now we are going to revise that neuromuscular junction. It's a type of modified synapse. You see you have a synaptic club. Above this you have the presynaptic end formed by the neuron.
Life should be ended now because I have to go. It's emergency.